Ironing away the wrinkles of life. A 19-year-old girl underwent an uneventful microkeratome LASIK at our center. Immediately after the procedure, the flap was noted to be well settled in both her eyes. However, on the next morning, she came back complaining of pain, redness, photophobia, and irritation in her right eye since midnight. Her BCVA was 6/18. On examination, we could see multiple concentric rings-shaped major folds in her LASIK flap. What could have caused such a distortion on her corneal flap, we wondered. The patient only gave a history of lightly rubbing her eyes once due to irritation. We decided to perform an epithelial debridement with stromal flap ironing under topical anesthesia. The procedure was performed under the microscope. Epithelial debridement was performed manually without the help of alcohol due to the fragile flap tissue. The epithelium was stroked with a blunt spatula nasally to temporally, since the flap was only attached nasally at the hinge. Epithelial debridement is an important step, since the migrating epithelial cells do not allow stromal folds to settle in their place despite complete ironing. Slowly and patiently, the epithelial tissue was removed in an anti-clockwise manner, each time making sure that the flap does not get displaced and the stromal bed does not get exposed. Once the epithelial debridement was complete, the flap was lightly lifted and the stromal bed washed to clear out debris. The fragile flap without any epithelial tissue folded irregularly, and it had to be handled with utmost care. Now, time for the ironing. Two PVA fiber-free sponge spears were used to iron the corneal flap perpendicular to the direction of the folds. Each time, pressure was maintained on the straightened flap for a few seconds. Very similar to ironing clothes, each and every fold had to be straightened with utmost patience and care. There was a leaf of epithelial tissue attached just inferiorly and inferior to the nasal hinge, which was not removed initially due to undue traction on the hinge. However, now I realized that this tissue was not allowing straightening of the stromal folds originating from this area. So, back to step 1, and meticulously the residual epithelial tissue was removed in smaller strokes, taking utmost care to maintain the flap in position. Once again, ironing was attempted. And this time, the stromal folds settled more satisfactorily. In the end, a bandage contact lens was placed, antibiotic steroid eye drops and lubricating drops were prescribed to the patient. In the immediate postoperative period, the flap was well settled under the BCL. On the first postoperative day, a central line of lamellar keratitis was visible under the flap. BCVA had improved to 6/9. Steroid drops were increased in frequency. The lamellar keratitis improved by the 4th post-op day, and the cornea was clear by the 6th post-op day with a BCVA of 6/6. Thank you for watching.